Okay, so today we are going to start a new chapter that would be Medicaid. So remember, we're talking about these government sponsored insurances. We talked about Medicare yesterday. So today we're going to talk about Medicaid. Now we're going to talk about Medicaid eligibility, who qualifies, what services are rendered to these policyholders, and how do we file for the claims, just as we did for Medicare. So that's basically what it is. It's not going to be difficult. It's kind of simple. Most of the stuff is very similar to Medicare, just a little twist right there with the eligibility, because that's the difference between them. They are government sponsored, but eligibility wise is the difference. In other words, who qualifies for Medicare? Let's talk about a little bit the history of Medicaid. So years back, says right there in 1965, the government, which is the Congress, established these new laws which benefit the population of this country that they don't qualify for other insurances, so they cannot afford other insurances due to the cost of it. So if someone has a low income, then they're going to qualify. We're going to discuss later on, I'm going to show you what is considered low income for an individual or for a family. Depends on how many people it is within the family. Then we have different kind of income regulations. So that's basically what it is. Now, why is it that this um, program of Medicaid came about? Because there were many people who, even though if they were working, they didn't reach the amount of money to cover for medical services. So it was too much for them to keep the daily activities, pay for the bills, for the rent, probably for the kids, and then, having to pay for medical expenses. So that's basically what it is, because they couldn't afford medical services. The government came out with this type of solution. So that's basically the whole story. Now, who is eligible for this? Now, once again, because it's a government sponsored insurance, just like Medicare, this is administered by the CMS. Remember, the Centers for Medicaid and Medicare Services. That's what it says, Medicare and Medicaid services, because it sponsors or it administers both of them. Because this is a government, once again, sponsor insurance. So that's basically the whole point to understand Medicaid. Is for people who have low income. Once again, we're going to see what is the criteria along income. But that's the point. So there are different types of Medicaid classifications depending of the need of the community. What is it that this particular person or this particular family, in which situation that person or that family it is currently? Because remember, this can change at any time. If your income increases, now you're probably not going to qualify for it, or you're going to qualify for less services. So that's basically what it is. So there are three classifications of Medicaid for eligibility. Who qualifies? If you are in one of these groups, you might qualify for it. So categorically needed. Now this will be one of the groups, medically needed and special groups. So we're going to talk about them. We're going to talk about this categorically needed. Who is it? Who qualifies for it? Who is in this category? That's basically what it is. And then we move to the medically needed. What are the criteria to qualify for this group or this classification of Medicaid? Same goes for special groups. We're going to talk about what those special groups are. Remember, this is for people that have low income. Because remember, this is a question for exam. That's how you are going to respond to the exam. This is the type of insurance that is given to a person who has low income. Immediately, you should be thinking about Medicaid, not Medicare. Remember, Medicare is given for people older after 65 or older. That's the one that qualifies. And usually someone who has worked at least for 10 years and paid taxes for Medicare after retirement. So those are the things that you have to consider every single time that you encounter these questions or situations with a patient who holds whether Medicare or Medicaid. So don't mix them up because it usually happens, particularly during exams, and you don't want to make those mistakes because these are straightforward questions, and I don't want you to, not to get these questions because these are the easiest questions there. So make sure that you actually, understand the difference between them. You don't have to understand the different classifications, but when we are going to explain this to you, then you will get a clear picture of why this person qualifies for these particular services versus someone else qualified for part of them. Because sometimes we don't understand. If we never received these services, never been through these services, you're not going to understand them. So that's basically what it is. Or if you're applying for them, you're not going to understand them because you don't know that there are classifications in which group this person is going to be or is going to qualify to receive services. Depends of the evaluations that the Medicaid services is going to, evaluate. We don't decide which one do we want. We just fill out an application, submit it, and then we're gonna get results. They're gonna say you are eligible for this, and for this, or nothing at all. So again, that is the importance of these lectures to understand for ourselves and for the patients. Remember, the patients always going to come, and most of the patients that we have in our clinics, they hold this type of insurances. That's basically what it is. That doesn't make the person less. Whether you have a private insurance, whether you have a governmental insurance, has nothing to do. What we need to do is, to make sure that every single patient that comes to our office, we verify that actually that insurance is active for the particular day of service. Because remember, other than that, we're not going to get reimbursed for those services. So that's basically what it is. And for Medicaid, it's very difficult to get money because we're not going to get it because the patient is a low income person. So we're not going to bill them because it makes no sense. So that's how it works. So let's talk about these eligibility criteria. So first, let's talk about these federal poverty levels. We are classified in certain levels of poverty. That's how it is. When you apply for these services, that's what they want to see your income. You want to present copies of your income taxes, whether you have them or if you don't have them, you have to show other proofs how you support yourself or who supports you. So that's basically what it is. So this year, in order for you to classify for Medicaid eligibility, got to meet the following requirements. If it is one person applying for, you have to make less than $15,000. This is $15,060. Well, just $15,000. If you make less equals or less than $15,000, you qualify for Medicaid. If there are two people living under that same roof, then the income increases a little bit because there are two people that are going to be benefiting from this insurance. So it will be a little rough over $20,000 per year, remember, income. If there are three people, then it will be almost $26,000. So that's how we are classified. If there are more than three living under that roof and wants to be covered for Medicaid, then you will have to make at least 31,000. No, at least no, the highest $31,000. So that's how it works. So when we apply for these insurances, they want to see our incomes, right? They want to see how do we support ourselves or who is supporting us, and they want to see how much is it. And that's what during that application they ask you about how many people lives, whether you pay rent and how much is the rent, how much are, food that you buy, the groceries, other services, if you pay, electricity, gas, cable, internet, all those things count because we're going to make sure that the money that you're making, when you pay all these bills, you're not going to have nothing left or almost nothing left. So how are you going to pay for your kids if you have kids at school? So all those things are part of, the criteria for you to be eligible for Medicaid. So that is basically what it is. So the first classification, which is categorically needed, that the group that applies for that is pregnant women and children under 6 years of age. Now, once again, the income has to be below the federal poverty level that they qualify. So they're going to be entering that information in the application when they apply for Medicaid. Or when you apply for anything, remember, you have to enter most of the information because they want to know, what exactly is that you are, applying for. So that is basically how it works. So this will be part of it. Now, other considerations, other types of population that classifies for this that can apply for this is caretakers. Which type of taker? Well, relatives or legal guardians who take care of children under the age of 18. Because remember, under the age of 18 is considered a minor. So if you are the caretaker or a legal guardian of someone who is underage or a little above underage, meaning 19 years old, but that still is in high school. Remember that by the age of 18, most of the kids are out of high school. They are probably in college, but not all of them. So they qualify for this type of category or needs for Medicaid services. Now, you're going to also qualify for a supplemental security income, which is also called SSI. Now, this is some kind of money that you're going to receive monthly. Now, what should be the criteria for you to get this money? Someone who is older enough, probably above 65 years of age. So it says there recipients or age recipients, meaning someone who is older than 65, seniors, blind patients or participants or individuals, disabled people, once again, that they don't make enough money to pay for the services. So they get an extra assistance for that. Some of them even qualify for the Supplemental Nutrition Assistance Program, which is called SNAP. So again, all depends of the needs of the client based on the income. But this will be the criteria, what Medicaid goes through, evaluates to make sure that every single client receives what they need because they are in need at that time. So again, later on we're going to talk about people lying or adding someone else to the group just to get other services, because that is called abuse, and how that will be punished if you are found guilty of abuse with insurance. Remember, everything has, tricks for people to do things here and there because they want to get, the services. Sometimes they do not qualify unless they do or play a little trick when they file in these applications. So we're going to talk about that because this is a serious crime, so to speak. So those are the criteria for these, remember, categorically needed, because we have 3 categories, classifications. Now we're going to enter to the medically needed. Now, this is another classification, remember. Once again, you're not going to be asked about these classifications. This is just for you to understand how Medicaid works. So you got a clear picture of what's going on. And if someone, is talking about this, you kind of understand what's going on. Or knows you might need it sometime. Well, there's nothing wrong with receiving assistance. That's what it's there for. If I lose my job and I don't have any income for any reason, any disability, or anything at all, I'm going to use these services. Why not? They are there for us. So you have to take advantage of any system that is out there, because I'm not going to go homeless. I'm not going to go and, starve myself or lack myself from some medical services just because, I don't apply for it. No, the services are there. And if I'm in this type or this classification of need, I'd most definitely apply for it. So it's there for it. Shouldn't be embarrassed for it. Why? The services are there. Why are you not taking it? As long as you qualify for it, you should use the services. That's what they're there for. You have a lot of money, you can pay insurance, good for you. But if you don't, you're also going to be covered. So that is the purpose of, having these governmental funded or sponsored insurances. Because probably I work, probably I didn't work for some other reason. Maybe someone worked for me, a member of the family, they didn't use the services. Maybe I can benefit from them. So once again, they are there for a reason. And we should not discriminate our clients when they come to our office. Oh, well, you have Medicaid, so you know what? You poor people, not gonna take care of you the same way I will do with someone who has a private insurance. Well, that is not appropriate. Remember, that's being biased, that is discrimination, and that is punished by law. So again, if the services are there and we need those services, we should use those services. So these are this medically needed category of Medicaid eligibility applies for, people who makes a little more money than, what the Medicare standards or limitations are. It goes a little above what the poverty level is. But guess what? They have, once again, more debts than, than the money that they have. So they are not going to be able to afford medical insurance because most of the money goes to pay services, the utilities, the rent, the food. So they don't have enough money to pay for insurance. So they will qualify. Once again, when you filled out these applications, they're going to ask you all these questions. I don't know if it is because I haven't applied for this, but I assume that they're gonna ask you how much money you spend monthly, because most of the time it's like monthly in services, in food, and any other miscellaneous, any other, sometimes not commonly expenses, but that's how it is. And you have medical conditions. You have medical conditions, you have to take medication, you have to go to the doctor. Because if you don't have medical conditions, probably you wouldn't be worried, right? But if you medically need it, if you make more income than the requirements or the limitations that the Medicare put you, then you can qualify, but you have to show proofs that the money that you're making extra, the money that you go above what is required by Medicaid, you have supporting information about where is this money going. So you still not getting enough to pay for your own medical insurance. That's basically what it is. Who else applies here besides those who makes a little more of income? Caretakers, relatives, or legal guardians who live with and take care of children. Anyone. So that's basically what it is. Remember, Previously, we talked about someone who is underage or up to 19 if they is still in high school. Now, here applies for those that are above 21. Well, for children, it's always apply, but it gives you a little exception for those who are 21 or older, but they're still in school, they're still in college, university. So it extends a little more these benefits to this type of population that are in medical need, remember, because that's basically what it is. So it's not difficult to understand. It's just, you don't need to know details, but you need to know that there are different classifications that you will be put or people will be put through to determine what services they qualify for when they apply for Medicaid. This is something similar like when you apply for, those grants for school. So they want to see your income or your parents, whoever you live with. If you are dependent, they want to see that income. In depends of that income, they going to give you certain amount of money to pay for your school. So that's how it works. So there is always a way of, classifying you, categorizing you according to income. Now you don't make any money, well, you're gonna qualify for all of the above. That's how it is. But they want to know just to make sure, that we are not gonna, the expenses are gonna go higher because these funds are to help the people that really need it. So we got to make the classification first. We don't have a standardized kind of, amount of money that we give to each one of the eligible Medicaid recipients just because, oh, you don't have enough money, so we're going to give you the same services. No, it doesn't work that way. They are classified depending on all these particular needs and who is living in that household. If there is more than one person living there. So that's how it works. So now you have kind of an idea. Now let's move to the third category, which is special groups. Now, which those special groups are? Now, once again, sometimes, you might think, well, everybody who has low income, they can qualify for it. Yes, you're going to qualify if you have low income. But how much is a low income? So this is measured a little different because they're gonna check that your federal poverty level is below 100%. So the ones that we covered before, they are above this, meaning you don't have any income at all. So for those special groups, we're going to talk about who they are because they also are going to qualify for the supplemental security income. Remember, this is extra money that you're going to get to pay for food. That's what you get, the food stamps and other services, maybe pay for rent, something like that, because just can't afford many things. So that's basically what it is. So all these co-payments, deductibles, co-insurance will be paid by the insurance. So you will not be responsible, let's put it that way, or paying any deductibles. So whatever is the balance after, the insurance pay for the services to the medical provider, you are not responsible for them. In other words, the deductible, the co-insurance, and sometimes the copayment is going to be paid by the insurance. It's not that I'm going to deduct those and I'm just going to pay the medical doctor 80%. Let's say that was Medicare. No, they're going to pay you more. They're going to pay you almost 100%, because now the premium that the patient, the deductibles, well, the premium too, because everything is covered. So the premium plus the deductibles plus the insurance plus the copayment, it will be paid by the insurance. There will no deductions from the insurance, because this is the government insurance. Now remember, Medicare pays 80%. Medicaid pays all, everything. And wherever you contract with them, whatever assigned benefits you were told you're gonna get, that's what the provider is going to get. Here, there is no room for appeals or challenging the insurance company for more money. No, that's what your assignment of benefits was. So that is it. That's what you're gonna get. That's basically what it is. That's why sometimes certain medical doctors do not take certain Medicaid patients. They take Medicare, but they don't take Medicaid patients. I said some of the medical providers because I know some of them that they don't take, because you're not obliged to take every single insurance. No, I'm the one who opens my office. I'm the one who invests all this money in this building, in this office, and all this equipment. I pay my staff. And if I'm not getting enough money, because Medicaid doesn't pay much. We talk about capitation, remember. So this Medicaid will be capitated. So it will be a fixed amount of money that medical providers are going to receive for each patient per month. It's not for every visit. No, a private insurance, a group insurance, a employer sponsored insurance, or the insurance that you buy yourself, that you purchase yourself directly from the insurance company, they're going to pay you per visit. And they have a certain fee for service already standardized according to what specialty, what is the location. Remember, we talk about this. So that's basically what it is. So if this doctor charges $200 just for the evaluation and management, just the time that I go there for 15 minutes, 30 minutes, that's what I'm going to get. And every time, if you come every day, you're going to pay me every day for that. So the insurance is going to reimburse me every single time for that. Whereas a fixed, a capitated payment from this Medicaid or the HMOs, well, we're going to get just a very small amount per client, per patient. Remember, this goes in between $27 and $35 per month. Whether the patient comes to our office 10 times, 20 times, once, no time, we're going to get paid, depends on what is it that the assignment of benefits was contracted with the insurance. We're not going beyond that. And you see the difference? I get paid $200 if you have a private insurance. Every single time that you come here is $200 plus the services that I provide for blood, all those separate. If they do a other type of procedures, separate. Everything else is separately. And then I'm going to get more when I have to read the results for this patient, because the patient has to come back again. You pay again. Someone who has Medicaid is not in that level. If the patient was ordered some tests on this, on that, well, the insurance is going to pay for that. But for every evaluation and management, I'm going to pay the same. The patient comes back again. The patient can come 30 times during the month. So every visit is going to be $1. if the insurance paying, a fixed rate of $30. If it is $27, it's less than $1 that we can pay if the patient comes every day. But, well, that is an assumption, an example. So most of the patient comes to our office at least twice, 3 times per month, because there are patients that have certain medical conditions. So if it is that case, we're going to get paid like $10 every single visit. So the point here is that some private offices will not take Medicaid because it's not enough. They don't pay enough for each visit. So if they see a couple of, 5, 6 patients from private insurance, they're going to get like $1,000, $1,200 versus if you see 20 of these patients, you're not going to get much. So that's how it is. But that is the government, and those are, the policies. And that is to cover for the services for the ones who actually need the services. Yes, they're not going to get all these benefits, all these inclusions, but they will get some basic benefits. Yes, you have to go through all these, approvals and authorizations in order for you to get this particular test because it has to be approved. So you have to get a pre-authorization. Remember, I'm going over these because these are the questions for your exam. That's how you know. Medicaid patients, they must get a pre-authorization before they get any procedures or any referrals. So you need referrals. Always you're going to need referrals. Remember, the purpose of these HMOs, particularly the government insurances, is to control the cost of all these payments that are done to the medical providers, and it has to be justified. It has to be a need for those services. They're not going to be reimbursing people just because you want to go to the doctor, just because you want to get this procedure done. No, that is not how it works. It has to be a necessity. Other than that, the insurance will not cover those services. So the doctor do not order them because they know they're not going to be covered unless it is a necessity. That's how it works. So these are the criteria for, Medicaid eligibility. So a lot of people, can qualify for it in different categories. Now, each state has their own regulations. Remember, each state has different names for the insurances. They have Medicaid, but they have other names. Instead of calling them Fidelis, they call it something else. Instead of calling them MetroPlus, they call it something else. So that's how it is. But it is Medicaid. And each state has their own regulations of how much money they're going to reimburse the medical doctors for the same procedure that they are doing here in New York or in Florida. They're going to have different, contracts, different amounts, different rates of money that they're going to pay. So that's how it works. Now, another advantage of Medicaid is that, if you've been disabled for some reason, they're going to pay for your rehab. And then they're going to pay you for some type of training. If you need training to go back to work, or if you need some type of certificate, some level of education. Because remember, some of the patients might come back to their jobs, but they cannot perform the job that they were doing before due to whatever problems they have encountered prior, what they were disabled for, what was the condition, what was the injury. So Medicaid helps that. So you can go back to work. So they provide you with all the tools needed. So that's how it works. And this is for people between, any age. But disabled people between ages 16 and 65 who have income and resources greater than allow under, the supplemental safe insurance. That is how it works. These programs are very important. So it includes anyone, but there is particular people that, can go back to work because after the age of 16, you can work if you have a permit, but you have to work certain hours. Now, remember, after 65, you qualify for Medicare, but also you qualify for Medicaid. So Medicaid is for anyone at any age, but once again, low income. But Medicare only applies for under 65 if they have a special condition. So that is the criteria. And Medicaid can be for anyone from birth, even before birth, because remember it's for pregnant females, until they die. Medicare qualifies only for 65 and older in some special conditions, like, the end stage of renal disease, which is one of the most common conditions for receiving Medicare before 65. So that's how it works. So it's not that difficult, again, just to remember who qualifies for Medicare, who qualifies for Medicaid. And when Medicaid is a primary, when Medicare is a primary, when Medicare is secondary, or when Medicaid is secondary. So that's basically what it is. So these are the points that I want you to take away from these lectures, because that's what's going to be helping you in your work, in your personal life, and to pass the test. So working individuals who become eligible for the group described above because their medical conditions improves. Now, we were talking about these people who were receiving money for disability, but then now they're getting better and they are ready to join back, the workforce. So that's basically what it is. But if for any reasons, remember, these patients cannot work in the same type of environment or type of duties that they were doing before due to the disability that they have caused them some problems to go back then. They can be trained, remember. Instead of having them as disabled, they're going to give them some training. They're going to provide them with wheelchairs, whatever they needed in some other type of training. So they can, perform other duties under, the conditions that they have. But we want you to come back to work. So that's basically what Medicaid is telling the beneficiaries. You don't have to be on Medicaid all the time. You can actually come back to work, do something, get a lighter type of tasks to do, but we're going to train you for it. That's part of Medicaid. Let's move for the benefits of children. Remember, any child at any age receives services from Medicaid. When I say any age or any situation, talking about legal situations as well, whether you are documented or not, you will receive Medicaid services because they have this state children's health insurance program. Of course, these books are not going to tell you that. It's not going to say, hey, even though if you're undocumented, you can apply. Well, hospitals, medical offices, freestanding health centers they are not gonna reject treating the child just because, you know, they don't have documentation. They're not gonna ask them, are you legal or illegal in this country? No, you apply for the insurance and it's given to them. So that's basically what it is. Now, each state, once again, is gonna have their own regulations for children, depending on what conditions they have, if they have any disabilities, or they were born with disability, whatever else, or it was acquired. They're gonna decide what type of services and how much money they're gonna receive if they qualify for it. So that's basically what it is. So they don't have to, you know, suffer the consequences of having a disability or becoming sick just because of the fact, you know, that they don't have insurance. They can qualify to apply for it. Remember, we're talking about Medicaid eligibility. Who qualifies for, you know, receiving these services? So that's how it works, and that's what we're gonna do. So if we have 4 children, well, we're gonna have also for the elderly. These are the 2 streams in our society. We have the youngster, we have the elderly. So again, here we're gonna use this term capitation. Remember, use a capitated payment systems to provide comprehensive packages of community-based services as an alternative to institutional care for persons age 65 or older who requires a nursing facility level of care. Now, remember that senior citizens or someone who is above 65 years of age, they qualify for Medicare. But if you do not qualify for Medicare because you did not work, your spouse did not work, did not pay taxes during at least a period of 10 years, then you qualify for Medicaid. And you qualify for all those services that are not covered for Medicare if you hold Medicare also. Remember, there are some services that are not covered by Part A because it's being institutionalized, sending you to a nursing home, being admitted to those places. So you can be admitted even though if you do not have Medicare or you have Medicare and Medicare Part A does not cover those services. Medicaid is going to jump in, so you can apply for both. You have Medicare, now you can apply. And if you don't have Medicare, no worries, Medicaid is going to pay for it. So that's basically how it works. It says right there, part of the Medicare program, but it's not optional services for state Medicaid plans. So again, Medicare pays to some extent to certain periods of time. Remember, every have limitations for time that you can be admitted to this particular institution. And if you run out, the days that you should be admitted in the hospital, they're going to move you to another institution, which is the nursing homes. And if you have a terminal illness, then you're going to be moved to hospice. And if you have a family that can afford to have you at home, having someone over there, even though if we're going to have a visiting nurse over there, but it's not going to be constantly every day checking the medications and the treatments that you need, then, you can have someone at home. So all those things are paid by Medicaid. So Medicaid usually paid for most of the things. Once again, you need to have pre-approvals first. Can't say, oh, well, I'm going to get this, so I'm just going to receive the services. I'm going to go to a nursing home. No, you can't just decide to go to a nursing home. Has to be all this paperwork has to be done to see what you qualify for and what type of services are going to be covered, depending on each individual. circumstances and income. So that's how it works. Remember, capitated means a fixed amount of money that is being paid to the provider. We're going to pay you $30 per month for our services for our clients. Take it or you don't take it. Do you accept the assignment of benefits? Remember, assignment of benefits means that the provider accepts this amount of money per client that they're going to pay for insurance coverage. So that's basically what it is. Now, remember, these services are paid differently. This is just for the evaluation and management. But if you need other services like, surgical procedure or a rehab for some reason, then the services are going to be reimbursed accordingly. Depends on what contract they have, but it's not going to be covered. Remember, these $30 that they pay as a capitation for a client, it's not going to cover the blood, the EKG. It's going to cover X-rays, CAT scans, MRI. That's a totally different thing. They have rates for those services and treatments and procedures. So that's basically the capitation is about just the evaluation, just the visit that they are receiving services from the doctor. Every other procedure will be rated, paid, reimbursed differently. Otherwise, nobody would work for that. Can you imagine? Okay. How do how are you confirmed that you are eligible? Because once again, you have to meet all these criteria when you apply for services. Patients must present a valid Medicaid identification card, because remember, I told you, anyone is not just Medicaid. It's for every single insurance. But because Medicaid is governmental sponsor, then how are you going to buy with the government? There's no way. You can probably fight with a private insurance company for reimbursement. But if it is for the government, well, you make a mistake. You didn't check, you didn't verify. First of all, they're going to pay you very little amount of money. And on top of that, you're not verifying their insurance card every single time the patient comes into your office. So then, again, we're not going to get paid, even though if it is this small amount of money. So we talked about already what qualifies a patient to receive Medicaid. Depends of income. That's it. That's basically how it works. So every time, remember, patient comes in, regardless of what insurance they have, but you're gonna get paid less. But if we don't get paid, bad for the office. If it is private insurance, it is more the amount. It's like 10 times more than, well, not 10 times. Let's say like 5 times more, 7 times more what Medicaid pays for. So we're gonna lose more. So gotta get the habit or, confirm and checking that, the patient has insurance coverage for that particular visit. We're gonna have ways to access and verify the insurance from the patient. Remember, in the office are gonna be different ways. You can check whether online, you can check through a Verifone, there are different forms. Making a phone call to the insurance company and verifying that this person has insurance. You're gonna use the verification device or system that they have in your office, and you learn how to do it. This is going to happen. You have to verify if you work in an office. Here we go back again with these Medicaid services, pre-authorization. And you have to go through this pre-authorization every single time the patient needs, even though for visits. Because remember, Medicaid limits you the amount of visits that you can have per period. Now I believe that is 6 months. I remember back in the days it was 1 year. So for a period of 1 year, you didn't have to renew your Medicaid services. And you were giving like all this amount of visits and certain services for a period of a year. Now they went back to 6 months. So every 6 months, you have to renew your Medicaid insurance. Well, that was until, several years that I remember. I don't know if I have changed because I'm not on top of that all the time, but that's how it was. So we need pre-authorization. See, it's going to be, we're going to admit the patient. You can't just admit the patient. Has to be pre-authorized unless it's an emergency situation. Any elective admission, any elective surgical procedure. What is elective? Elective means that you're not being admitted or the surgical procedure is not done immediately during that particular visit. So I have some time to prepare, have some time to send, this authorization to your insurance and to receive the pre-authorization. That's why someone who has Medicaid and you require this particular procedure that we send for a pre-authorization, it takes some time. The procedure is not done immediately. You know that. So some of them, they have to wait certain period of time, depending. Sometimes you might be denied for that procedure because there is no actually necessity for it. So the medical doctor is obliged to present, to submit all the supporting information and try again and see if they can get this authorization approved. So that's basically what it is. For emergencies, as I said before, it is automatically done because you got an emergency insurance at that moment. Anyone who doesn't have insurance and you have a complication, you go to the emergency, even though if you don't have insurance, they will give you an emergency insurance that lasts for 30 days, I believe. And then you can apply for an insurance that is, you can use more frequently. But you have to get pre-authorization, even though if it is for an emergency. But in that case, we're not going to wait for a month to get the pre-authorization. They're going to do the procedure. And because it was an emergency, it's going to be approved. So that's basically what it is. But if it is an elective, remember, we have to wait for pre-authorization. In an emergency, the pre-authorization the authorization is given. So that's basically what it is. So for anything done, you're going to go and do a procedure that is taking more than, you're going to be hospitalized, or you're going to be in observations for more than, a day or two, or something that, is calculated based on the type of procedure, we need to get pre-authorization. We don't have to get pre-authorization to get blood work. You go for a blood work, the visit requires, probably you have high cholesterol, maybe you have high levels of glucose or else. We don't have to get pre-authorization for that. We're going to get pre-authorization if you have x-rays, CAT scans, MRIs, or any other surgical procedure. Or if we were going to refer you to see a specialist, because usually these are costs that, adds up to the insurance company, and it has to be approved because it has to be, once again, necessity. See, I always said it has to be necessity. Other than that, the insurance is not going to pay for it. Oh, I'm just wondering whether the patient has this or that. I'm not sure according to my evaluations. So I want to make sure that I'm going to send for the X-rays. Well, what if the X-ray doesn't give you any result? Oh, well, I'm going to send for the CAT scan. What if the CAT scan doesn't give you any idea what's going on? I'm going to send for an MRI or anything else. No, you cannot use all those services if you're not sure. It's got to be a necessity. It's got to be something that you found out and you need to prove before you start treatment that this medical procedure is actually needed. That's how it is. It's not because the doctor decides so or because the patient requests for it. No, it's not. It's got to be proofs because I have lab results. I have bloods that shows that you have this particular condition. Now let's do a biopsy. Biopsy is not just done because the doctor wants to. No, it has to get a pre-approval if you are a participant from Medicaid. So that's how restricted this insurance is. So again, if you have a procedure, even though if it is not in a hospital, because remember, we have outpatient procedures. What is an outpatient procedure? Colonoscopy. Colonoscopy, a biopsy, an endoscopy. It might be a pap smear. So all these procedures are done in the office, whether the medical doctor's office or a specialist. But it has to be approved because these procedures usually are very costly. So we need to charge for them. So that's how it works. Pre-authorization. So don't let anything go by. When your doctor asks you to get a pre-authorization form for the patient to be sent for, to a specialist or for a procedure, you got to complete that pre-authorization. Usually, medical doctor complete it, but you have to send it if you do not have electronic medical records. Otherwise, the medical doctor will send it directly to this particular person, then whether the patient select to be that specialist that they want to see, or someone who is being chosen from the patient's insurance directory, or someone that we have on files if the patient doesn't have someone that they wish to see. Because remember, we always have a list of medical specialists when we refer our patients because we withdraw those from the Medicaid or the patient's directory from the insurance. So that's basically how it works. So we got to make a decision and send those and receive the authorization. If we don't receive the authorization, then the person that we are referring to, when they're going to have the appointment, they're not going to take care of you. They're not going to be seeing you because that's what is the authorization number? We need the authorization number. Oh, I don't have it. My primary doctor requested. Well, we haven't received it yet. So, in other words, we cannot make appointments for the patient to go for this procedure until we get this authorization. So pre-authorization is what we submit to the insurance company. And the insurance company is going to send you the authorization. We're applying for it because it can be granted or denied. So that's how it works. So every time that patient comes in, you can have different scenarios. Or you can offer them, to make the appointment for them if they have someone that they want to see, or we have someone from the directory of specialists that takes that particular insurance that we can send them. So that's another thing. Remember, patients usually do not know where to go. So we have to select sometimes the medical provider or the specialist or wherever the procedure is going to be done for the patients. It's our job. So that's basically how it works. And the patient cannot go there until we get the authorization from the insurance company. So failure to send the pre-authorizations to the insurance company, it is the responsibility of you, the medical practice. Now, sometimes it happens, because being there, seeing that, the patient says, oh, no, I get my own specialists to go to because my friend knows someone, she got the same procedure, I want to go there. Well, you got to make sure that you got to call your patient. You're going to make sure that you follow up with them and says, hey, do you have the name of the person? Because we need to fill out that application to send it. Otherwise, you're not going to get the procedure or the evaluation from this particular provider. So don't let things just go away with, the idea that the patient, because the patient is not the one who's going to do it. The patient is going to give you the information where they want to go. But you have to follow up on that. That's why we have a list from Medicaid providers in our office that we can refer you. You give you choices. Listen, I have a medical doctor that can do the procedure in Manhattan. Oh, I don't live in Manhattan. I live in Queens. Do you have anyone in Queens? By the way, we do have someone. It's in this particular address. Oh, I don't know what it is. Is the train stops there? Remember, you have to do everything for the patients. You can't just put the patient, okay, I'm going to make an appointment, whatever you feel like you want to put them. That's not how it is. You're not going to schedule patients for procedures, patient that needs referral, pre-authorization, wherever you wish is where the patient wants to go. Because if the patient doesn't go for any reason, we're going to be responsible for it. So again, unfortunately, that's the way it works. So save yourself some trouble and do the job accordingly. Believe me, if you don't do this, you're gonna get in trouble. And probably you're gonna get your office in trouble. Remember, this person do not receive that procedure the day that it was supposed to, the insurance is gonna pay services to the person that you make the appointment, but the patient is not gonna go. They're gonna get paid, but the patient didn't get the services. Now the patient wants to redo that, well, to do it because they actually didn't get it. Now they're not gonna get approved the second time. And now if the patient gets sick, they can sue you for malpractice. So it is our responsibility, not the patient responsibility. That's what we ask. We give options to the patients. Where do you want to go, Mr. and Mrs. Smith? I have Queens, I have Brooklyn, I have Manhattan. If they accept and they say Manhattan, they don't go, that's their responsibility. But we're going to call them prior to that. Hey, Mr. and Mrs. Smith, don't forget you have an appointment, I schedule an appointment for this particular office for this particular procedure. Oh, don't forget, you have to stop taking the medications prior. You have to follow this diet. You have to be fasting or non-fasting. You have to tell them, remind them. That's our job. But remember, failure to do that, we are going to be accused for abandonment. And abandonment is a part of malpractice, negligence. So that's basically how it is. So the medical is very complicated. It's not that I did my job. Okay, I scheduled my patient. I'm done. No, you have to follow up with them. And when the patient gets the procedure, we're going to follow again with the medical who did the procedure because we need the results of that procedure. So it doesn't stop there. And if the medical doctor recommended a post-treatment after, you have to follow up with it too. So the work never ends. For a patient who has procedures or evaluations, we have to follow up with them. This is not like I'm going to order something and it's up to you if you want to go. It is up to the medical doctor that you refer them to if they want to send you the information or not. No, we have to request for that information if they don't do it. Sometimes that's not their patients, but this is our patient. We are the PCP. We are the gatekeepers because these Medicare patients, they have a gatekeeper. They cannot select another doctor, go to wherever they feel like it. No, it has to go first to your primary care physician, and they will decide where you can go next and what services you can receive and where. So that's how it works. So it's a little more complicated. Remember, this is government-sponsored insurances, so they always complicate it when it comes to the government. Any questions about pre-authorizations? Because believe me, this question comes on an exam. This comes on an exam. So before this patient that has this particular insurance receives these services or referral, what do you need? Pre-authorization. Pre-authorization. You have to have that. Sometimes they use pre-certification, but most of the time the correct word is pre-authorization. You don't see anything else. You don't see pre-authorization, but you see pre-certification. Well, it has to be pre-certified before you receive those services. So remember, sometimes it's not, so clear that you're going to say, oh, wow, I got the answer right here. No, that's what I give you, different definitions for different terms. So you might encounter either or. And you have to be familiar. This is like the encounter form, super bill, charge slip. You can use any of these three terms, and you got to be familiar with it. So that's how it works. Any questions about pre-authorization? Good. Payments for Medicaid services. We talked about this already. Remember Medicaid, because it is a governmental funded. The negotiation, the contract that they have with the providers says that the providers must accept whatever assignment of benefits they have agreed with. That's basically what it is. Nothing else. So fee for service, yeah, fee for service is the same thing. Whatever they decide to pay, but they have this capitation. So whenever you hear about HMOs, Medicaid, they have a capitation, particularly Medicaid. They have capitation. Remember that under Medicaid are all these insurance companies that are called Fidelis, Health First, United Healthcare, but the HMO ones. MetroPlus, Health Plus, something like that. There are some others out there. So all of them have a capitated payment. So we don't have to ask the patient anything about that. They just have to see their, their insurance card. That's it, and verify that. That's the whole purpose. Medicare, Medicaid relationship. So this is when we talk about who is the primary. Remember, I mentioned this yesterday. Now we're going to talk about it again. These are the most common insurances out there funded by the government. Medicare, Medicaid. Medicaid is small because, it covers anyone from birth until no longer exists. Medicare, 65 and older, and certain conditions. So that's basically what it is. So here is when we need to know. As I mentioned yesterday, I said that if the patient has Medicare and Medicaid, Medicare is going to be the primary. It's the insurance that's going to pay the benefits first. And Medicaid will be secondary. Now, remember, if you have only Medicaid, well, it's the only insurance, so that's the only one who's going to pay. So you got to pay attention to your clients that they have Medicare and Medicaid, particularly if you are the one who are, completing those insurance form claims. Because this is a problem when you file as the primary insurance Medicaid, when you have Medicare, or you have an employer-sponsored Medicaid, or you have your own insurance that you purchased, you bought it yourself because you have money. So no, employer-sponsored private insurances, they are always the primary. If they have sponsors, employers insurance plus Medicaid, sponsor goes first, and sponsors plus Medicare, sponsor goes first, always is going to be first. Medicare is going to be second. If you only have Medicare, Medicare is going to be the only one. So on the bottom, it is highlighted. It says Medicaid is always the payer of last resort. Remember that I mentioned this. So if you have a question when they say, which of the following insurance is considered the insurance or the payer of last resort? Medicaid. Medicaid is the answer. Because that's how it works. Remember, Medicaid is the one that pays the minimum to the medical doctors. Medicare pays well, but Medicaid pays the lowest. Remember, Medicare, you pay taxes already. So this is your money that they're using to give you services after you retire. So it's not the government that is giving you anything. Well, the government doesn't give you anything anyways. But it's paying from your money, the money that was deducted from your taxes all the time that you worked. That's Medicare. Whereas Medicaid is for anyone who even do not work. Because remember, it's for low income. So for that reason, it's more restrictive. That's what it has capitation. So the government pay the medical providers just a little portion of what the real services value is. So these are the things that you need to keep in consideration when you take tests. And whenever the patient comes to your office, so don't look at them and it says, oh, wait a minute, this person looks like old. It might have Medicare. Oh, doesn't look too old. Probably don't have Medicare. No, that's not the question. We don't check people, how they look like to see whether they have or don't have this particular insurance. Oh, that looks like kind of poor. They probably have Medicaid. No, we don't go by that. We check the insurance card. And that is it. We do our due diligence. Verify, verify, verify. Ask for it all the time. Because if you enter the wrong insurance, the billing department is going to use that one. So we got to ask the patients always. They have one insurance. Say, do you have another insurance by any chance? Oh, yeah, because they show you the Medicaid. And they said, do you have another insurance? Sure, I have Medicare. So now you know that this is the primary. So you know now that you have to add those two, particularly when the patient joins our office for the first time. You're not going to ask them, do you have Medicare or Medicaid? No. Do you have insurance, Mr. and Mrs. Smith? Sure, I do. Do you have a secondary insurance? Oh, do you have insurance through your husband? No, this is my husband. Oh, now you know that is dependent. Does your husband pays for an optional insurance? They might have a second one. This is very important that we have all the information about the insurance. How many insurance cards they have, because that's going to benefit the patient. Because if the patient has one insurance, then the balance is going to be sent to the patient or to the policyholder. But if the patient has two, then one is going to be the primary, the other one is going to be the secondary. So the secondary is going to, pay for the balance. See how beneficial it is for the patient? But if we don't ask, then we might run into the situation. So we're always going to be asking the patient if they have one insurance card, do you happen to have a second insurance or through, your spouse? So we're being kind of general, your husband, or so you don't say anything. Your spouse is a lot more convenient because you might not have a husband, you might have another wife. You might be a guy, might have another guy as the partner. So we don't go like that. So your spouse, that's it. It is a lot more professional than asking your partner, because sometimes we go by that, but it's better to say your spouse. Because remember, unless they are married, they will not receive the benefits if they are not. The kids do. So that's how it works. So we gotta make sure that we know what we're doing, what we're asking, so we don't have inconvenience later on. Because remember, the problem arises when the patient receives a bill and they come to the office and they're going to give you a hard time, good on you. Because you immediately assume that the insurance pays for everything. You haven't paid, but hey, you didn't ask me for the other insurance. Remember that the patients do not know how, these insurances work. They think, oh, I have one insurance, I always present that one, but it turns out that you have a second one, or you just got another one, or you just got married to someone who has another insurance. Because we don't know, but we ask. Because other than that, you're going to be listening from these patients that are going to be very angry. Because anytime that you send them a bill, they're going to come to you. And you're the one right there at the front, taking all the hits. So you know how to handle it. It's not your fault, remember. But we have to ask every necessary information, because if we don't, that can have troubles. You ask if their name has changed in the insurance. Sometimes the insurance shows that you're not eligible. You don't have coverage. It's because you changed your last name. You were married, now you are not. Now you have somebody else's last name, or you just remove the last name that they used to appear on that card. So think about that. Things happen. So we have to be on top of everything. Oh, you don't have insurance. The card says no. Don't take it as, 100% accurate answer. Now you ask other questions. By any chance, have you changed your address? Have you changed your name? Is your name still the same? Can I see your ID? But then, they might tell you. But if you don't ask the question, they just present the card. That's all they're going to do. So be careful with all that information that we collect and how we collect it. And be professional all the time. Empathetic. That's how it works. Dual eligibility or eligibles. Now, what is dual? Well, dual means two, right? That you have benefits from this insurance and from that insurance, or you have two insurances covers at the same time. See, Medicaid will also cover for these things that, remember, Medicare does not. That's what we need, the Part C. So remember that I mentioned that when you have Medicare, they don't pay for certain prescription drugs. They don't pay for eyeglasses. They don't pay for hearing aids. They sometimes don't pay for dental. implants or any type of dental work. So Medicaid will pay for it. So you see the advantage of having Medicaid, but you have to meet the criteria in order for you to apply for Medicaid. That would be nice, right? It doesn't matter how much money I make, I still can apply for Medicaid. No, you don't qualify for that. That's what they require you to have income tax. But it's not just giving me numbers. You have to show copies of your past, I don't know if it is 5 years income tax. I don't know that. But that's how it is. And they're going to actually contact the IRS to verify whether you qualify or you don't, whether you enter false information. So you got to be very careful with the information that you provide to the insurance company. Remember, this is the government, so they have access to all the information about you. If you have solicited, we have applied for different other services, so you currently have different services under other names, or so to speak, then they're gonna know. So you have to be very, very careful. Remember how you feel for these claims. That's something that you need to understand. Participating providers. So, as I mentioned before, see, these participating providers have already accepted Medicaid payments, and they accept these predetermined or determined payments in full. In other words, whatever the Medicaid pays you to the, to the provider, to the medical office, to the hospital, they accept it. And remember, you cannot bill the patient for the balance. Can't. That's prohibited. That is illegal. Patients are not going to pay for it because they know that they're not going to pay for it. So don't try to, try to be smarter than them, because it's going to create problems. So you have your assignment of benefits, you provider contracted to Medicaid, you say, I accept whatever money you're going to pay me for these patients according to these services or evaluations and visits. So that's what you're going to get. And that is it. There will be nothing else. Remember that Medicaid pays for the premium, the co-insurance, for the deductible, and the copayment. That's what the patient doesn't have to pay anything. Remember, the patient has a problem. The patient has not earning enough money. So how are they going to pay extra? Makes sense. Now, this is now that we have all these HMOs. Because remember, back in the days, that was like in the 2000s and something, Medicaid was a plain Medicaid. There was no Fidelis, no Health Plus, no Metro Plus, none of these other insurances that are part of Medicaid. There weren't. And at that time, Medicaid was acting like Medicare, but for low income. And at that time, a Medicare policyholder have a copayment. I remember it was $5 for those patients who came to the office. Because once again, I was assisting, working in one of my friends' clinic. So I learned all that stuff early on. So I still remember that. So now things have changed dramatically because we have several insurances under Medicaid. And those are the names of the insurances that depends on the state, it changes. That's why sometimes when you have Medicaid and you have these particular insurances under Medicaid and you go to another state and you happen to go to a hospital, they might not cover for your services because each state have their own regulations. Or you have to go through all this paperwork in order for you to get, covered for those services if you are out of state. Not that you move to that state because you have to apply for new insurances over there. Because the insurances that we have here and certain benefits that we have here in New York are not the same the ones in Florida or Illinois or California or any other state. They have different regulations. So that's how it's called Medicaid, but under Medicaid, there are other names of insurance that just work as much as, the insurances that we have here, but different rates, different, eligibility, qualifications. So again, it's not the same everywhere you go. So that's how actually work. Remember, for these participating providers, you will get, reimbursed the money that you agree with them during the contract. So that is it. And that's all you're gonna get paid. It should not, by no means, bill the patient for any balances or any procedures that you think that you should be getting paid more, because it doesn't work that way. Medicaid and managed care. So now remember, managed care is this organization that, have a group of medical insurances and for a better, lower price services. That's basically what it is. So Medicaid is part of managed care. Because remember, managed care was created with that purpose to lower costs of medical insurance. Says right there, 60% of Medicaid population receive benefits through managed care. Well, I might say that is 100% because Medicaid belongs to, no, it is part to managed care. It works the same everywhere. Now it said 60% because 60% of the population in the United States applies for Medicaid somehow in some circumstances. So that's basically what it is. So all these participants or, policyholders from Medicaid are part of the managed care. Remember, well, before managed care, Medicaid was a plain Medicaid, only Medicaid, just like Medicare. Medicaid didn't have no parts, but it was Medicaid alone. So Medicaid was accepted just like Medicare. People didn't have no problems because they were paying you a customary fee for service. So whatever the medical charge, that was paid. Then it came out this managed care. Now they came out with this capitation. This capitation was not like that before. Before was just regular, the Medicaid paid just as regular as Medicare or as any other medical insurance for services. But because it is a, governmental funded agency, they were seeing that, people were abusing. Patients were abusing of the services, requesting for services they didn't need, or going to the medical doctor for things that they didn't have, and then the Medicaid has to reimburse. Medical doctors were abusing because they were ordering tests that they were not needed. We talked about this before. So then managed care came about. No, we're going to control this. If you are receiving money from the government, then this is how from now on, this is how we're going to control expenses, payments, reimbursement, services to the patients that holds this insurance. So that's how it works. And it's not going to change. At the contrary, every single time there are more limitations for the policyholders of Medicaid And Medicare is also going to change. So it's going to be the time that probably not going to have any of those, because this is changing a lot. Remember, before they covered almost everything. Now they have lots of limitations. And for every single thing that goes a little beyond and it costs this much, we need pre-authorization. Every single time you need a referral. See, back in the days, if you have Medicaid, you don't need a pre-approval. You don't need the pre-certification. No, or you don't need the pre-certification or pre-authorization. You can select any doctor that you want to, whenever you want, just like a private insurance. Now you have a gatekeeper. Now, back in the days, you didn't have one. Oh, I didn't like this doctor. Oh, I'm not going to come to this doctor anymore. I'm going to choose another one. So you went and find someone else. And if you didn't like that one, you move to somewhere else. You can switch anytime that you want to. Now, you don't have that luxury, because Medicaid is very restricted, not only with services or who your gatekeeper is going to be. So if for any reason you didn't like your doctor, then you have to call Medicaid and ask them, okay, I need to switch, but you need to tell them what is the reason. You have to have a valid reason. And you cannot switch several times during that 6 months period. You're going to be able to switch one in those 6 months, then wait for 6 months, and then you're going to switch if it does what you want, and if you have enough, evidence for the reasons that you want to switch. So you kind of stuck with this medical provider, at least for 6 months. Now, if you have a private insurance or your employers, you can switch. You can go wherever you want. All depends on your plan. So you don't need a pre-approval, pre-authorization. I always say pre-approval, but it is pre-authorization or pre-certification. You don't. So that's how it works. Okay, so how do we verify whether this patient has or do not have coverage for that day? Remember, having the card in their hands does not guarantee that the patient has, coverage. Coverage means that the patient today is, has coverage, is eligible to be seen, meaning that the insurance is going to pay. That's basically what it is. As I mentioned before, we can do it over the phone. We can do it electronically, meaning using a software application or point of service device, this very fun terminal. This is a little machine that looks like the credit cards. Actually, is used for credit cards as well. When you kind of slide the card or you enter the ID of, the Medicaid, and boom, it comes out on the screen and you can print it out, whether you are eligible for that particular visit. Remember, Medicaid can change overnight. They can cancel your insurance at any time for any reason. We have no control over that. But we do have control about verifying these insurance cards every single time the patient comes for service. This is very important, and that's what I'm being repeating this over and over and over. Well, not just because this is a question for the exam, because this is what's going to keep you on the job. Because remember, we have a bunch of people who has Medicaid services. If you do not verify in the office of the provider, do not get paid for these services, get a denial for the insurance claim, now you're gonna be in trouble. Because we don't work for free. We get paid. So that's basically what it is. Any questions about anything about Medicaid? Because we're done with Medicaid. I cannot believe that this went so fast. I thought it was going to be a long chapter. Well, actually it was, but kind of summarize all the stuff because it's just too much repetition and we have enough already to understand Medicaid. So let's move to the next chapter, which is workers' compensation. So let's talk about workers' compensation, because this is important because questions on your exam. Because you're not going to be a builder or a coder, probably you're not going to have to deal with this, but there are certain circumstances where you might encounter this and you need to discuss certain things with your patients. You need to follow certain guidelines when you have patients who have workers' compensation. But remember, what is a workers' compensation? Someone got injured on the job. That's it. One of the things that we have to do for the exam, and I'm going to repeat this during this chapter, maybe 5 to 10 times. The reason why we need to know about what is compensation or just what is comp is that, every single time that that's another thing, if your medical provider accepts compensation cases, because not every single office it is accredited to do this. You have to be a participant. The office, my friend's office, we didn't take compensation cases. Why? Because this is a troubled cases. This is very complicated. You even have to have attorneys involved. So we don't want to go through all that. So we just take regular patients. But you do have to ask the questions when the patient comes in. Oh, my back hurts. I'm here to see the doctor. Sure, not a problem. Okay, so can I see your card? No problem. Oh yeah, you have coverage today. Please have a seat. The doctor's gonna call you. That is wrong. Why? Because the patient is showing signs that they have an injury probably. So the next question is gotta be, how did you get this back pain? Do you have this before? Yeah, I always get the back pain. I don't know what's going on, but did you get injured in your job? You have to ask this. This is the magic question. Yeah, I was lifting some boxes, so I fell down from, a ladder or this chair. I put the chair to reach something because, wasn't able to reach it, and I fell. Well, immediately you do not register this patient because this person was injured in the job, so we cannot add information to the regular medical records. We have to create a new medical records. Think about patient is being admitted. We create a new medical record. Patient enters the emergency. We create a new medical record. What is the third time that we create a new medical record? When the patient has a, compensation case. If the patient was injured in the job, it is a compensation case. Immediately, we stop. It's not that you're going to tell the patient, oh, I'm sorry, but no. Don't tell patient anything because the patient is going to be very upset. Because the first thing that happens when you get injured is you come to your doctor. So don't tell the patient, oh, no, excuse me, you're in the wrong place. You have workers' compensation. They don't even know what workers' compensation cases are, but sometimes. So don't talk to them, in that way. Says, oh, can you excuse me for a minute? You talk to your supervisor. You talk to the doctor. Either or, the one that is there, the one that is available says, hey, by the way, do you guys take compensation cases? Because I think that I have one. But you talk to them in private. You don't say it loud. You don't say in front of the patient. You go outside, said, oh, can, can, can we talk? Do you have a minute? I have a patient, and the first thing that you ask them, do we take compensation cases? If they say no, then you say, well, I have this patient. She's just here, and she's an established patient. According to her, she's been here before. Or this is a new patient. So you have to ask questions before. You can go say, oh, do you take compensation cases? Is that a new patient? I don't know. Is that, I don't know. I didn't ask anything else. No, you have to get the whole picture. And then you clarify this with someone if you don't know. So one of the things that I always recommend my students when they go to the internship, talk. This is the time that you're learning. Find out in this place, in this clinic, in this hospital, wherever you've been sent, do you guys take compensation cases? Why? No, I just want to know, just in case someone comes in. How do you go about that? Just learning process. Remember, it's part for you to learn this stuff because you might end up in a clinic, in a hospital, in a doctor's office when they do take. Most of them don't. But if they do, you need to know how to go about this. But you get all the insights, or you get all the answers you ask the patient. Because remember, the insurance, the primary insurance from the patient or secondary insurance for their health, they will not be responsible for compensation cases. So we're not going to get paid. That is it. Remember, if you read the form, there is a block there that they're going to ask you. We went over that and it says, how did this problem occur? Were you injured on the job? Was a car accident? Was on the job? No. Oh no, then now if someone says that they have diabetes, that they have this, well, that's part of it. So that's a condition. That's not something that was injured in the job. So it's when they come with a cut, with a broken bone, with a back pain, with a lump right there in the forehead or the head, and they said, what happened? Oh, somebody hit me with something. Oh, on the street? No, in my workplace. I have a fight with one more coworker. Well, this is a workers' compensation case. Remember, workers' compensation cases are not taken in every single office. There are special offices for that. Second of all, if you do take that, if your clinic take compensation cases, then you need to start a new medical record. And you have to ask someone how that goes about. See how important it is to understand all this? Because if you start writing down information on the patient medical record, like vital signs and the chief complaint, and then you're going to tell the patient, oh, by the way, we don't take your case here. After you waste my time there, why didn't you tell me to begin with? Why you made me wait all this time and get all my information? And then you're going to tell me that I'm not going to be seen here. Particularly for those patients who are already established, because they don't know. They just come for help and assistance. And remember, the insurance, your personal insurance, is not going to pay for compensation cases. And we're going to see why. That's how it works. So that will be workers' compensation. So let's do a little introduction before we go on break. So everything is based on government. Remember, the government is the one that determines which cases are considered, workers' compensation, and which cases are not, and which regulations we should follow when the patient comes to our office. So here it is. Federal and state laws requires employers to maintain workers' compensation coverage to meet minimum standards, covering a majority of employees for work-related illness and injuries. We explain injuries, I already explained it to you. Injuries is you fall. You were driving this company car, you have an accident. It's not a car accident. This is your workers' compensation because that's the way that you work. It is through your work. You work for the post office. You work for UPS. What is the other name of these companies that they travel and they go? So once again, this is a workers' compensation. Yeah, it's gonna be some car accident where that has nothing to do with you because that would be paying the damage from the car. But what about your damage, your health, your wages, the time that you're gonna be off, your medical expenses? So this is the responsibility of your employer. So your employer have a side, they put some money and they have workers' compensation insurance. So that's basically what it is. So it says right there, as long as employee was not negligent in the performance of the assigned duties, so then they will not be covered. Well, that is to be seen, right? To be proved. So let's just forget about, as long as it wasn't from the side of the patients or the client or the employee negligence. What would be some of these situations? Well, you work in the laboratory and you're supposed to wear a mask because you're using all these fumes over there and you don't want to inhale them. You were supposed to wear certain garment, a waterproof gown. You didn't. Now you get injured with some chemicals that you were handling. So you were negligent, right? It was your fault because if you have wear all these protective equipment, you wouldn't be at risk. You couldn't be in the situation. But that would be the attorneys who are going to be determining that. So whenever you're going to do something that is going to put you on risk, you got to wear or use any equipment necessary to do the procedure because it's provided to you. If you you fail to do so, then. But let's go aside that. Your employer must have compensation savings, workers' compensation savings. So just in case someone gets injured on the job, because eventually it happened, so you have to. Now, that would be for an injury. You fall, the floors were, wet, nobody cleans them, you were passing by, you slide, you slip, you broke an arm, your leg, whatever happens. You're going to be disabled for some time of time. They're going to pay for your salary, your wages. They're going to pay for medical, for anything that you need, rehab if it is needed. Anything that you need is going to be covered by workers' compensation, not by your regular insurance. See, that's the reason why, we do not register patients who are assumed to have, the injuries from their job to be taken care of. Now, illness. Remember, illness is a condition that you develop. It's not that you have an injury. It's illness. You're sick. Well, you were exposed because you work in this particular mine and you were exposed to these poisonous gases over there and you developed cancer of the lungs. Now, your employer has to pay everything, anything that is necessary, even though after you die. So we will go for that. All the disability time that you have, whether it's partial disability, temporary disability, permanent disability, all those costs are going to go from this workers' compensation money that your employer has to have, not from your regular insurance. It doesn't work that way. So that's something that we have to take in consideration. Occupational Safety and Health Administration, which is OSHA, right? We talk about OSHA all the time. Why? Because it's important for the safety of the employees or whoever comes to our office. So this is the organization that protects employees against injuries from all these occupational hazards in your workplace. What are those hazards? Well, chemicals. In our medical, we are in the medical, we have chemicals there. We are exposed to all these medical conditions, infections, body fluids. Because if the person has a condition, you might be exposed to it. So that is basically what workers' compensation do. So we need to make sure that, we meet all these standards. So Occupational Safety and Health Administration, which is OSHA, reinforces all these standards for all their employers to make sure that they provide you with every single piece of equipment that you need and information about all the hazardous materials that you're going to be handling or perform when you're performing your duties. Failure to do that, then you didn't tell me that this chemical was going to cost me this, you didn't give me the equipment, so now you are at fault. So it is your responsibility, employer. So for that reason, you're not going to use your personal health insurance. You're going to use the employer's workers' compensation insurance. So that's how everything works. So you got to be very careful with this workers' compensation. So what is it that we are going to be covered for workers' compensation? As mentioned before, lost wages, remember, your salary, the money that you are making, you're not going to stop getting it. You're going to get paid for it. All your medical expenses, you're going to get paid for it. If after the injury, it requires after the treatment, the surgical procedure, whatever happens during all these treatments, you require some type of rehab, physical therapy, or hearing therapy, speech therapy, any type of therapy, or any type of medications, or any type of equipment that you need in order for you to go back to, almost normal, then this workers' compensation has to pay for it. Now, here again, just like Medicaid did, if you got injured on the job, now they cannot fire you. They cannot fire you. They have to keep you until, medicals decide whether you no longer can perform any duties on the job. But if you are brought back to the job and you no longer can perform those heavy lifting or whatever it costs you to have the condition because now you are injured, maybe temporarily, maybe forever. So then, they have to train you in something else. Whatever it takes, they have to do it. Instead of, giving you permanent disability. So, no, we're not going to train you, go home, we're going to keep on paying you. Well, your job is not going to do that. So they're going to offer any compensations, any type of educational or any other type of training. So you can perform some type of task and duties that doesn't affect whatever condition you have developed. We're not going to put you at risk again. So that's basically how this works. That's how it applies for these federal work compensation programs. Remember, it is your job responsible for paying your wages, your medical expenses, your rehabilitation if it's needed, training if it's needed, temporary or permanent disability if it's required after the medical doctors has evaluated you and determined that. Now, one little thing before we go on break is that you do not select who is going to be your workers' compensation doctor. Your employer is going to tell you who you're going to see. Because remember, this is not your regular insurance. This is not any other insurance. This is the workers' compensation insurance. This is the workers' compensation that is owned by your employer. So you have to go wherever your employer asks you to go. And they're going to tell you, you're going to be seeing this particular doctor. And that's the only doctor that you're going to see. If you refuse to do it, then you lose all your benefits. You lose all your rights because it's not what you want. Is who they assign you to do. Why is that? Well, first of all, I'm the one who's paying for your medical services and rehab and everything else and your wages. So I'm going to determine where you're going to go. Second, because this person is going to notify me as the employer how you are doing. If you are getting better, you are getting worse, or you actually didn't have anything. And I'm going to follow up with this doctor because this doctor is going to tell your employer all the your status, how are you doing, how are you developing, every single test that is being ordered, if it is being required, all those things we're going to know information about you. That's basically what it is. And these doctors are going to determine when the services no longer are needed or for how long these services are required. So that's how it works. So you do not go and say, okay, I have my own workers' compensation doctor. No, you're going to go to wherever your employer assign you. That's it. No other choices. Other than that, you're going to lose all your services because if you go to an attorney and says, no, I'm referring this and this is by law. I'm following the law. I'm going to, render services to this person, but this person doesn't want to go to the medical provider that are assigning there. They want to go see their own. No, it doesn't work that way. So you take it or leave it. All right. Any questions about a little introduction about, workers' compensation? Okay. So let's take a break. We come back 7:40. Things that 7:40 is the time that I like. Well, the time that works for us, right? So we're gonna do that. 7:40, we return and we're gonna continue with this workers' compensation subject. Okay. So see you at 7:40. Enjoy your break. Here it's raining a lot. I don't know in your area, but it's raining a lot, which I don't know if it is good or bad, but if I'm at home, I don't mind, right? See you guys, 7:40.
See you in a bit, Professor.
Thank you.
Thank you.
Bye now.
Thanks.
Mhm. Okay, so we are back. Hope you guys enjoy your break. So we're gonna continue with Medicaid. So that's basically what. Okay, so we were talking about what it is covered by the workers' comp. Oh, it's workers' compensation that we're talking about. Sorry, my bad. I was thinking about Medicaid still. So we're talking about workers' compensation. So we know already what will be covered under workers' compensation. Remember, we need to understand workers' compensation for many reasons, particularly because we're going to be working in an office and we do not want to encounter ourselves registering a patient through their health insurance when actually this patient has to be through a workers' compensation. Remember, we're not going to get paid. We're not going to get paid. But before that, we're going to get into trouble because the medical doctor is going to ask questions when they start examining the patient. And one of the things that they're going to ask is for how long this has been going on, how that happens. And they said, oh, I just followed, that just happened. Then that is it, the end of that interview. So the patient is going to be told that I'm sorry, but we do not take workers' compensation cases, and you have to go look for a workers' compensation doctor. You go back to your job, and the whole story. So that is a problem right there, because we entertain the patient for so long that the patient is going to be very upset because we did not let them know in advance before they waste all their time over there. So be careful. Now, before we move on to the next part, let me clarify you something else. Remember, I mentioned this before, but I'm going to mention it again. When someone has an injury on the job, they got to make sure that they're going to report this immediately to their supervisor. Tell other people that works with you. You got to let them know. Say, hey, I just fall. Listen, I have pain right here. Or even though if you don't have it, I just fall. I just have this particular injury. Or something else happens to me. Why? Because you have to fill in a form, remember, a incident report. And this incident report is going to protect you, whether temporary or permanently. If you don't report it, and then you complain that something happened, your employer is not going to be responsible for you because you did not notify them that something happens when you were performing your regular activities on the job. So it has to be notified. Remember, it is your responsibility. So there is no excuse not to do so. So be careful with that part. So here we come. So there are different ways of being compensated. So in other words, there are different situations, different organizations, different insurances that protects you as the injured person. All depends what type of work you do, who do you work for. So that's basically what it is. So if you are a private or public employer, remember private means you work for a firm, for a corporation that is not funded by the government. Public is something that is funded by the government. You work in a public school. You work in this public building or the IRS. This is government offices. So all depends on where you work. You're gonna have some type of insurance by that employer that is gonna cover for your services. So that's basically what is telling you right here. So that will be acting up on, the situations. So we have what's called state insurance fund. Remember, because it's a state is paid, funded by the government, or it is paid by these private offices. So that's basically what it is. So we're not gonna get paid for every single company is gonna pay for our service. No, all depends who is our employee, our employer, who are we working for. So that's basically how it works. So state insurance fund, you will not be asked about that. Self-insurance plans. Now employers with, this is your group sponsor employer. So that will be self-insurance plans. So if you work for this particular company, your employer is a regular employer, well, this is what you're gonna go. This is where the money is gonna be taken out to pay for, your wages and medical expenses, in rehab, whatever other services you will need. So that's basically what it is. So remember that this insurance company, sometimes it doesn't matter how many employees they have. It doesn't matter. You're going to be responsible, even if you're going to get money from your pocket. You work for a small organization, for a restaurant. They don't have many employees. Remember, in order for you to provide health insurance, you have to have at least between 20 to 50 employees. So now you will be obliged to render health insurance, regular health insurance. But if it is workers' compensation, anyone, it doesn't matter how many employees you have. You have only one employee. This employee got injured on the job, you're responsible. You're going to pay from your pocket for the expenses because you don't have a fund plan, insurance plan to pay for workers. Well, you're going to pay from your money, but you're going to pay this person for all the expenses incurred while the patient is injured. So that's basically what it is. So again, everyone who has employees, they have to have some money aside to pay for workers' compensation, because that is the responsibility of the employer, regardless of who is the employer. It's a private, it is a regular company, it's public, you have to have it. That is it. It's not the same as your health insurance, remember. Not every company is obliged to give you health insurance. You have to have certain amount of employees in order for you to be obliged as an employer to give your employees health insurance. But workers' compensation, even though if you have one employee, something happened, you have to pay for those from your pocket, not the personal insurance. And very careful with negotiations that you might have with the employer. Because the employer says, oh, well, I'm going to pay for services, but don't report it. Don't do anything. Well, if you don't do that, then, this employer can just get away with, step away from whatever they offer you. They're not going to be paying for anything. So you have to report it. Probably you have to get an attorney. Usually in this type of cases, you get an attorney involved, because that's what's going to force your employer to pay, the maximum of, whatever expenses are going to be required while you are out work, or if you're not able to go work, or if you die, and how family gets compensated. So if you see on the news, on TV all the time, they have all these attorneys, and you see everywhere. So you have information, you have these signs about these attorneys. And one of the things about these attorneys is that they do not charge you until they win the case. So basically that's what it is. So if it is something serious, you definitely need an attorney, because otherwise your employer is going to try, to play games with you, let's put it that way, not to pay you, not to cover for all the expenses. and much less pay for, disability. Sometimes it might take years for you to recover or to be able to go back to work. So who's going to pay for those wages? Remember, you got injured right on the job. So you're not able to do certain things. You were working, so you should get compensated. So that's basically how it is. Those benefits must come to you, the employee. So commercial workers' compensation insurance. It is up to your employer if they're gonna, they're gonna put funds on the side, have it in part of the corporation, or they're gonna pay an insurance company for compensation, workers' compensation if you need it. So that happens a lot. So it says right there, employers are permitted to purchase policies from commercial insurance companies. Of course, as long as you cover for the services for this injured employee, it doesn't matter where you get the money from. I'd rather have a policy versus trying to get my savings from my company. I might go broke to pay for this. So again, it doesn't matter where you get it from, but you can get it from any commercial health insurance company and use it as not the employee's personal insurance. It's not that. It is a separate fund for the compensation. It doesn't matter where the employer get the funds or the insurance to pay for its compensation, the workers' compensation benefits. It doesn't matter, but it's never the same as your personal insurance. Even though if it is the same company, the same insurance company that I have my employees affiliated with this commercial insurance, I cannot use the same personal insurance, say, okay, no, go to the doctor. No worries, don't say anything. Just say that, you have this in your home. And then you're gonna go get services. But if something goes wrong, you're not gonna get compensated. They're just gonna kick you out. They're just gonna fire you because you lied in the first place. How are you gonna retract yourself after that? Remember, employers are gonna try to do whatever possible. I'm telling you, for you, this is not what we tell our clients, our patients. No, we don't get involved in any of these issues. The only thing we're gonna tell them is whether we take workers' compensation or not. Remember, this is like Medicaid. Not every single office takes Medicaid. So not every single medical doctor is going to take workers' compensation. It's up to the doctor if they want to or not. So it is very complicated to deal with workers' compensation. And sometimes to get reimbursed from these workers' compensation cases is very, very difficult for the doctor to get the money right away. So again, that's the reason why medical doctors, not everyone takes workers' compensation. So it has their flaws. So for that reason, no. So employee, who is the employee? So we're gonna kind of narrow down here what type of injuries the employee is considered workers' compensation. Remember, it's not just that you fall, it can be something else. Injured while working within the scope of the job description. Even though if it is not, somebody was sent to do something that they weren't supposed to be doing, still they're going to be responsible. For workers' compensation, it's a different issue. This is not a malpractice case. This is not a negligence case with the patient. This is the employee and the employer. So that's a different issue. So if you get injured when you're doing your tasks, something happened to you due to someone else or to your own fault, still that's going to go to be investigated, and you will start receiving workers' compensation. To begin with, injured while performing a service required by the employer. Well, of course, the employer require you work for them, they ask you to do, but that might be something that was asked to go outside. Oh, go get me these particular tools that I need. And then you go to Home Depot. When you went to Home Depot, you're still working for them, but you were outside the facility, right? So then you were injured, you're gonna have workers' compensation. In other words, you will not use your personal insurance because that is not gonna cover. You develop a disorder that can be directly linked to the employment, such as asbestosis. See, asbestosis, this is this particular chemical that it is within, all constructions, paint, and insulation materials that was used back in the days. So if you live in a building that was built prior to 1940s, you have asbestos. So that's basically what it is. So what is it that this asbestosis is? This is a condition of a cancer in the lungs due to the exposure to these particular chemicals contains within these materials that you're working with, particularly if you work in construction. So that's something that has to be taken in consideration. Or you were exposed to any hazardous materials at work, and then you became injured. You were exposed to these fumes, these chemicals, or radiation. See, people who works as a radiologist or radiologist technicians, and you are exposed to radiation and you develop cancer or something like that, then they're going to be responsible because this was a task that you were exposed to it. So they're supposed to give you some protective equipment that you have to wear when you are performing these particular tasks. And there are many other things. Remember, if you get exposed to a body fluids and the patient has a medical condition and it's passed on to you, but not to because you were negligent. Remember, that's going to be investigated whether it was negligence from your part. You didn't do the job correctly, and that's the reason why you exposed yourself. You didn't wear the mask or the appropriate mask. You just went over there knowing that the patient has a condition and then you acquired that condition. That's under your own risk because you didn't meet the requirements. Still, until this is proven otherwise, you're gonna get some, compensation services. But that's mostly what, makes you eligible for workers' compensation cases. So we need to understand exactly what it is. Remember, if it is a condition like diabetes, high blood pressure has nothing to do with your job. If it is arthritis, nothing to do with your job. Or if it is a fracture, some type of cancer because you were exposed to certain fumes, certain chemicals in your workplace, then they would be, providing you with this workers' compensation. Remember, it's not just to you, but you support your family. So if you are no longer, able to do it, they have to support you until you die, and thereafter, because the family will receive the benefits because you are the primary provider for them. So that's how it works. See? Worker does not have to be physically on the company property to qualify for workers' compensation when they get injured. I mentioned this before during the introduction. What do I mean that I don't need to be directly in the workplace? Because your workplace is driving. So you have your base, you go to the warehouse, you have to drive a truck, like the FedEx truck, the UPS truck, the trucks that delivers all the goods to the supermarkets, to the pharmacies, and else, to the gas stations, whatever you do. Well, you were hired to be driving, to be transporting these away from the base, from the hardware, the warehouse. So It's still the employer, the person that happens during your time of work. So they will be responsible. So if you've been asked to go out to buy something and you were struck by a car, you were hit by a car, by something else, or you fall outside and you get injured, you're still in your working hours. It's just that you were asked to go somewhere else. Now, if you do it on your own, you leave your job and you go shopping and something happened to you, then, your employer's not going to be responsible for you. It is if I'm giving you an order, I'm your employee, your employer, I'm sorry, and you're my employee, and I ask you to go do something, then it happens. But if it is your job to go away, see, like cab drivers, truck drivers, they don't have to be there. Or someone who has to do a construction job, you have to go to the side of the construction. That's not what the company is. That's not where, human resources is at. It's not like, the school. I'm working for the school. And let's say that something happens to me. I'm working from home, but it doesn't matter. I work for them. It's just that this is one of the ways of, doing my job. But it was during my working hours that this happens. Not because I wasn't teaching. Instead of teaching, I was, playing soccer or playing baseball and got injured on the job, or was just driving around. Well, that's not part of my job. I had to be doing my job. So that's what it means that you don't have to be physically in this particular place. Now, one more thing. The parking lot of your organization during your breaks, that's the responsibility. The restaurant across the street, you went to buy your food during your break. It doesn't matter if it is your break. Something happened to you, workers' compensation. So we have to take in consideration lots of things. See, some people say, oh, physically I have to be in this building working. If I'm not in my office when that happened or within the premises, then they're not going to be responsible for me. No, if you are within your time frame of work and you are within the premises or outside of the premises because your job requires to do so, they're going to be responsible for you. Remember, your personal insurance is not involved. It's not used for these purposes. It has to be the workers' compensation. Because that's how it works. Remember that your personal insurance, your health insurance, does not pay for disability, because that's not the purpose of that insurance. In a case when you got injured, remember, that's a different issue, that you have a condition and that condition worsens and now you can't do your job. That's a different issue. Versus you got something that it was acquired when you were working and that was the product, the result of, something that happens to you. So that's a totally different issue. So be careful when you see questions about, whether, you have to be physically in that company in order for you to be compensated. No, you don't have to be physically there because your job depends on going outside of your warehouse or your company office, and you have to do your job somewhere else. As long as you are doing the job from this person, it doesn't matter where you are. You will be compensated through workers' compensation. Remember, failure to use workers' compensation insurance is going to be the reason why your medical provider is not going to be compensated. And as soon as they don't get compensated for the first visit, forget about the rest, because you will not be seen anymore. But the condition or your situation is going to worsen. So that's the reason what I said that you have to actually tell your supervisor or your boss or whoever is in charge whatever happens. Remember that I told you the story about someone that we know. She fell on the job. She didn't say anything because she was new. She was afraid that if she said something, they were going to fire her. Then, a few years later, you start getting these headaches, back pains, and things like that. And she went for the medical visit. They encountered that she has a very serious lesion in the spine. She couldn't walk anymore. She couldn't lift things anymore. Well, because you didn't report it, guess what? Your job just fired you. You cannot do the job. Now you are disabled. Now you have to apply for Medicaid, which is not going to cover everything that you need. Because you develop this on the job. There are many situations in which you get injured, and these signs and symptoms do not show immediately, particularly the nervous system. They do not show immediately. Fractures, yeah, okay, of course, it's going to be noticeable. A bruise is going to be there. Sometimes you don't develop any of those, but internally you have something and starts getting worse, but very slowly, but continuously. So next thing you know, things start bothering you and you think that, oh, this is normal, I have this before. But when you encounter in a situation where you can no longer perform your duties or your daily activities, you're gonna get, certain evaluations and they're gonna discover that something serious is going on. Probably you're not even gonna relate it to whatever happens prior because you thought it wasn't a big deal. So you just cover yourself to be sure. Even though if you are out of job, you lost your job or you left your job and you come back and you go to the doctor and they said you have something. It says, have you happened to be injured before? Say, oh yeah, by the way, like 5 years ago, I was working in this place and I got injured. I didn't present any symptoms at that time. Oh, I didn't go to the doctor, or I did go to the doctor, but they said that I have nothing. Oh, no worries. Now you're gonna get an attorney and you're gonna get, covered. There's gonna be some investigations, but eventually, if that correlates to whatever issues you're having now, they might end up paying your workers' compensation. Because remember, some of the things, some symptoms, some signs do not present earlier during the event. It might happen later on. So that's basically how it works. So we got to make sure that we cover ourselves. Classification of workers' compensation cases. So according to the law, because everything is law, remember, medical treatments, because all depends on what type of injury you probably have, or if this injury, whatever you encounter or you were exposed to it, is going to get you disabled, but just for certain period of time. That will be temporary disability. We're going to talk about that in more detail. Or permanent disability. You're not going to be able to go back to work at all. You can do anything. Rehabilitation, whether it was a temporary disability or permanent disability, they're going to pay you for rehab. Survivors benefits, remember, survivors are the family members, the people that you are supporting, people that depends of your income. They're going to be compensated, particularly if you die due to, to the condition that you develop after, the incident or the injury that you develop on your job. So for that reason, we have to mention it, because if you die, well, you probably not need more of these assistance, but your family will. So that's why we have to report this. It's very, very important. Remember, these lectures not always are taught for, how you take care of your patients that have workers' compensation or not, but also for ourselves. If you're working in a company, they don't have to tell you, okay, well, you're not going to get health insurance because, according to the law, I have less than 20 employees. Well, you're not obliged, but you're not going to ask, oh, do I get workers' compensation here? We never ask about workers' compensation because they have to have it regardless. They have to pay you. If you ask for workers' compensation when you're applying for a job, 100%, you will not get the job. That I can reassure you. I never seen or hear someone asking for workers' compensation, because remember, that's a red flag. Asking, okay, if I get injured in the job, am I gonna get compensated? You guys gonna pay me my workers' compensation? Well, think about it. If you're asking for it, it's because you're planning to do something, right? So, hey, I don't want you here. You can ask during your interview about the schedule, the hours that you're going to be working, where you're going to be working, what you're going to be what you be doing, how much you're going to get paid, whether you're going to have sick days, whether you're going to have vacation pay, overtime pay, because this is important for you. But you would never ask about workers' compensation. Remember, that's something that you don't even mention it. So let's talk about this classification of workers' compensation. Medical treatment. Well, it's medical, right? You have an injury. Well, we're going to send you to these particular medical doctors. Remember, your employer is going to select where they're going to send you. Employee continues to work or returns to work within few days. So if it is just a minor issue, but regardless, you're going to get compensated. Because remember, this is getting, worse and worse. We start with cases that are very, minimum involvement or very light injury. So you're going to go to the doctor, they're going to give you, some evaluations. Probably they're going to do some procedures like, if there is fall, they're going to do x-rays at least or a CAT scan. Otherwise, you're going to get some blood work or you're going to get some other evaluations by a professional and, a neurologist, who knows, psychologist. So it doesn't take too long because it wasn't a major thing. But if it gets more complicated, well, we're going to see the next situation. Temporary disability. Now, this is going to cover not just medical expenses, because the first one, it was just medical treatment. So medical expenses, you went out. Of course, we're going to pay you for those days that you're not working. Are you going to return to work? Now, this one, temporary disability, now you're going to get paid for the treatment. You're going to be paid for, your wages, your salary, whatever money you're making, you're going to get paid. They're not going to pay you less. They're going to pay you as if you work still performing your duties. Now, that can be temporary or partial. Remember, temporary total disability or temporary partial disability. So what is temporary total disability? That you cannot work during this time that you are disabled. What is partially? You are not doing all the duties that you were doing before. So you're going to be missing some days. They're going to put you to do some light work while they getting, for you to get better. So either or they will, calculate more likely how much money you're going to be making. Still, you're going to get paid regardless, wages and medical expenses. Permanent disability. Now, this is very serious because now you are not able to return to work. You can perform the duties that you were doing before. Or you cannot do any light duty tasks either. So you can't just work. That's basically what it is. You have permanent total disability, permanent partial disability, schedule loss of use, disfigurement. So again, there are different terms right here that are used, but the point is that you're not going to be able to work. It's permanent. You're not going to be able to return to work, period. You cannot even do light duty work. Remember, when you have temporary disability, we can accommodate you to do some temporary tasks, even though if you are in a wheelchair. Well, we might, train you, send you to get capacitated, educated, learn something that can be applicable to the job, not whatever you were doing, but something that is lighter job, if there is possibility. But when it's permanently, we cannot count on you. So we have to pay you for the wages, for the treatments, without having you on the job. So that's how it works. Any questions about disability up to now? Vocational rehabilitation. Now, this is for you to get rehab. Remember, whether it's temporary or permanent. Even though if you're not working or you're not planning to go work, but you have a disability that was acquired due to an injury in your job, they have to pay you for that. Because they try to get you a little bit, at least that you can do the daily activities in your home. At least you can do something on your own. Because you were okay when you were working. So now you can't just let me out without responsibilities. That's not how it works. So that's basically what it is. So they just gonna pay you for all these type of, any type of rehab. It can be physical, it can be mental, it can be psychological, it can be due to the hearing loss or blindness, any type. Have to give you rehab until, they determine, that there's nothing else they can do. But they're gonna keep you on. Survivor benefits. Now remember, this is money or benefits that are provided to the dependents, someone who is an eligible dependent. That includes parents and grandparents, relatives. But they go for the first part, which is your spouse, your children. But if you don't have them, you have someone else, like a brother, well, they're gonna fight for those. So that's how it is. Because you have to be compensated, particularly if you die on the job because something was done, something causes the death of the person prematurely before it was expected due to something that happens, an incident. It's not like the patient just died on natural causes. That's a different issue. We're not talking about that. We're talking about an injury on the job, an illness when performing or being exposed to some hazard materials in your job. That's why every single time that you start working in a place, they gotta tell you during the orientation, because most of the people will have an orientation when they start working. They're gonna walk around the building or around the offices, wherever you're gonna be working, they're gonna be showing you. As simple as it may seem, they have to show you what are the, these emergency exits, where the extinguishers are, just in case of fire. All those things are important. What chemicals you're going to be working? What chemicals are you going to expose to it? It's not assume, oh, I'm going to be working in this place, so I'm going to, no, because there are many chemicals that, unless you inhale or you are directly exposed to them, meaning somebody throw them on top of you, that will cause you something. No, sometimes just the fact that you enter this room and they have this chemical somewhere and the fumes are escaping from that particular container and you're being exposed for a long periods of time, that can cause you something. So that will be the consequences of that exposure to the particular chemical. So they have to tell you, your job, what is it that you're going to be doing? What is it that you will be exposed to it? And not only that, this is the equipment that you have to use if you are handling these particular hazardous materials. Again, if you don't use that equipment, that will be your fault. But proving this is going to be a little difficult. In the meantime, you will receive the benefits. That's how it works. So survival benefits are very important. Because remember, there are many instances in which, the employee lost their lives, but they have a family. They were supporting a family. So now those benefits goes to them. It's not a medical insurance that they're going to get. It's the money. They're going to be paying money, not only for the funeral expenses, no, for them to support after a certain time. Because remember, if they have kids, at least until they reach the majority of age, for education, for health services, for food, for rent. So it's a lot. So usually these compensation cases awards lots of money. That's how it is. But they're there, and that's why you have an attorney. Remember, in every single case of workers' compensation, there's always an attorney involved. You gotta get it, because if you don't, then your employer is gonna play games with you and not being responsible with the expenses. You're just gonna start paying the expenses, but would think that things goes a little over whatever they were expecting, then they back up. So that's how it is. So you have to have an attorney. So that is no question. Had to get an attorney involved. Special handling. Now, again, think about this like, what money you are getting. What is the reimbursement that you're going to get from a regular insurance company? It applies almost the same. So providers are required to accept the workers' compensation allowable fee as payment in full for covered services rendered. So that's basically what it is. So they have a contract as well. This is an insurance company. Just because it's a workers' compensation, this is an insurance company, something that is going to pay for the medical services plus, your monetary compensations from salaries or whatever else is required. So that's basically what it is. So anything that involves you to be injured or ill in your job goes to this particular compensation, workers' compensation insurance. So that's basically what it is. We're not worried about how much money the insurance is going to reimburse to the medical provider. We don't care. We just care about receiving the benefits that we have, that we need. And here it applies the necessity of doing or running this particular test or surgical procedures. It's not that you're going to get kind of a pre-authorization, so to speak, but they do some type of, evaluations to see whether, it will help to get that particular test, like, an X-ray, a CAT scan, an MRI, a surgical procedure. Whether this rehab, you can receive it for this period of time. So that will be, something that the insurance have to determine. But then that's where you have your attorney, because your attorney is going to fight for you. Because if you're not feeling better, if you're not feeling, that you can do any activity and the job wants to force you to come back and do a light work, then, if you have an attorney, then you're going to put them to work. Remember, they will not get compensated until you win the case. So they have to do their best to protect for their own and your interests. So that's basically how it is. So the insurance company, they arrange with the employer in whatever contract acceptance of benefits they have contracted with, then, that's basically what they're going to get. We just worry about getting paid because they have not only to pay for the medical expenses, but also for these lost wages, remember, and any other things that are needed for this patient to get better, or at least to, become somehow functional for themselves if they cannot come back or go back to their jobs. So that's how it works. First report of injury. As I mentioned before, remember, you have to report it immediately after something happened. You must report it. This is not an option, but many people fail to do so. So that's basically what it is. See, reports of injury forms should be completed. This is an incident report. It doesn't say there, workers' compensation. No, it's an incident report. That's it. And you're going to tell exactly what happened. You're going to complete. It is you, the one that is going to complete the form, because you are going to document what exactly happened, where, when, at what time, what were you doing, and what actually happened. What is it that you're feeling now? And from then on, the medical doctors, they have a new medical records and they start documenting everything. Remember, you're going to get a new medical records because it's a different insurance that is going to start making the payments. And this was a case where it was an injury on the job, has nothing to do with your personal medical records. So that's basically what it is. So now you got to keep copies of these incident report. So copy should be given to each of the following departments or organizations. It's not that you have, I just completed the incident report, that's it, I'm done. No. Well, it is done from your part, but someone else within the office, when you report this and the person that you give this report, they have to make copies and place it in different files. The employer designated compensation payer, who is the insurance for the employer. Where is it that I'm getting my workers' compensation? Do I have a, did I contract it with a commercial insurance, or how is it? So you have to give to the person who is in charge of those funds for compensation. So that's basically how it works. Now, ill or injured party's employer. So the employer is going to receive another copy. The insurance receive one, the employer receive one, and guess what? Who else need it? The patients. Chart, because the patient is going to have a new chart, and right there in that medical record is going to be another copy. So anytime that someone reads the medical record, they're going to go and read how that happens, when that happens, what was involved. So that's how it is. So the patient has to relate there, has to document what happened, what was the outcome. So again, it has to be complete. You should not leave anything out, because any little detail can be a reason why you will not get certain services. So tell everything that happens during that incident. Then that will be evaluated, and depending on that, you receive certain evaluations from a medical provider. Remember that these medical providers are selected by the employer, not by you. First report of injury. You have a timeline to file for this form. Remember, you can just go home and come back at the next day because you develop some pain, or you woke up and you're not able to. Oh no, I'm sick. What happened? No, because I felt yesterday. Well, wait a minute, it's been more than 24 hours. Sorry. So that is something that they will not take into consideration. Well, whoever answers the call because you call in sick or you send a message, they're not gonna contact you to ask you anything else. They're gonna let run those 24 hours because you didn't inform them. So I'm not gonna ask you much. Remember, the employer, they don't want to pay. Who wants to pay? It is you, the person that is affected by the injury, that needs to claim these benefits. You are entitled to. So time limit for filing this form varies from 24 hours to 14 calendar days. Why? Because if it was something that happens, you were unconscious, you were brought to the hospital, you are in an intensive care unit, how are you going to fill out this application? You're probably in coma, very severely injured, or based on your state, but most of the time is because of the condition in which you are. Remember, even though if it's something mild, report it, document it. It's not just to report it. Hey, I fall over there. No. Let's fill in that application, that incident report. Do you think that your supervisor is going to say, yeah, they told me about that? What is the document? You're going to be responsible for not, giving this incident report to your employee. So you failed to do so. So you did it on purpose. They're not going to say, no, I was never told. I never heard of that. Remember, like in medicine, when we were documenting this, if you didn't document what happened, well, now what happened? No, it didn't happen. So you didn't document it. never occurred. So it has to be documented. You have to protect yourself. Some people don't know about it and they get fooled by the employer. So again, this is not something that you're going to discuss with the patient. The only thing that you need to understand this is for your own good because you're going to be an employee. But with our patients, the only thing that concerns us is whether to find out if the reason that the patient is seeing us, I have a burning sensation when I pee. That has nothing to do with an injury. So, you're not going to be asking if this happened on the job, if this happened at your home. It makes no sense, right? But if they come with pain, back pain, swelling, deformity of the leg, a broken bone, bruises all over. Okay, what happened? Don't assume that this person was mugged and was beaten outside in their homes or whatever, the neighbor. No, it probably happens on the job. So we gotta make sure, remember, to collect this information. Patient employer must be contacted to obtain the name and mailing address of the compensation payer. Remember, you're gonna contact exactly that insurance company where the employer has contracted with, because we're gonna send them a notification about the injury of the patient, and they're gonna send you the address and the name of the doctor that you have to go see. So that's how it works. So remember, for workers' compensation, you don't use your personal insurance, your job insurance, your own self insurance. You don't, because this happens on the job and someone else is going to cover for this, and that's going to be your employer. So don't forget about that, because remember, you're going to need that information. What will be the information that you have to document on that incident report? Name and address of present employer, name of immediate supervisor, date and time of accident or incident or onset of disease. If this disease was, related to something that you were exposed to it in your job. Site where injury occurred. Patient's description of the onset of the disorder. What is it that you start feeling? What are the symptoms? There were any signs there. There were bruises. There were this. There were that. Remember. Now remember, date, time, place, because that is very important. Because if this happens on the streets, if you weren't supposed to be on the streets or was your day off, your job is not responsible for that. So understand this. You work Monday to Friday from 8 to 5. Something happened during that time period. Even during your break. No worries. That will be works compensation. That will be your employer's responsibility. Oh, you left work. That has nothing to do with your employer. During the weekend, you went to the beach, you went to the amusement park, something happened to you. Well, it's not going to be covered for workers' compensation. That's what it says, workers' compensation, meaning it happens on the job during the time frame assigned to you to do your duties, whether you are physically on that location or the location that was designated to you to perform your job. So that's basically what it is. Now, when it says a description, remember that I told you you have to explain exactly what you were doing. Whether you fell, whether you sleep, what was there, whether it was exposed to something, whether somebody hits you on the job, you have a fight, anything. Remember, this is an incident. or accident, whatever you're going to call. But most of the time, we call it incidents. So that's basically what it is. You were operating a machinery, something went wrong, you got crushed by something. Anything that happens on your job, you are going to report it. Remember, if you're drawing blood, you get poked, stuck with the needle that is being used, meaning that you just draw blood or you were drawing blood, you have to report it. Because you can get any conditions through it, particularly this, infectious diseases. And if you don't report it and you develop the condition, they're going to tell you, oh, no, you get this somewhere else, not here. Do you report it? No. Oh, but I did get stuck with the needle. Well, too late. There's nothing you can do. This is not the time for you to report it. When you start getting signs and symptoms, or when, accidentally they found or incidentally they found certain values on your blood work or any other evaluation. It's too late. Remember, you have some limited time when you can report this. And the best time is now, the moment, right there when things happen, regardless how serious it might look. Report it. It might be helpful later on. So that's basically what it is. Progress reports. Now, progress, as the word implies, we need to keep, the status of your evaluations with that particular compensation medical provider. How is the patient doing? Is improving? Is getting better? It's not improving. It's getting worse. Patient is not recovering. Remember, we want these people or this person to go back to work. Why? Because we're not gonna pay, we don't want to pay more wages or medical expenses. So the sooner that you get better, the sooner that your health improves, the faster that you're gonna go back to work. But if things don't happen that way, we need to be ready, because we need someone. See, we got someone. We're not thinking about the patient only. We're thinking about who is doing that person's job. Now we're paying this person that is out of the job now. Well, we need to pay someone else who's going to cover for the job that this person who is disabled or who is in the hospital receiving treatment was doing. So somebody else is going to do the job, but we got to pay now two people. One, the disabled, the other one is the one that's doing the job that the other person is doing. So when it comes to money, remember, we always going to be like very vigilant on how this money is used. So that's basically how it works. So we need to keep, track of what's going on with this condition of this patient. Where is this patient at this time? When it comes to, health-wise. So this medical doctor is reporting continuously to the employer, so they know what's going on with this patient. And these medical doctors are not going to be bribed by the patient. But if they get someone else, remember, because this medical provider is with the employer. That's what the medical provider wants you to see. Someone who is within his network, within the insurance that they pay, because they're not going to play you. Other than that, remember, a lot of things can happen. Other information that can be documented, patient, well, of course, the patient's name. That's when you create the medical record. The compensation file case number, because this is a compensation case. So we don't create a medical record number only, we have a case number. All the treatments and progress of those treatments. The work status, whether the patient is going to receive a medical care, but the patient is doing some type of work at the same time, or the patient is not doing anything, so it's temporarily disabled. Any information about any other tests that might, further tests that or treatments that the patient might be receiving. All that is told by the medical providers ahead of time. As soon as they get the information, they pass this information to the insurance or the employer, and the employer is going to know how things are going with that particular patient. So very interesting. So someone is keeping on track what's going on. It's not like, oh, I'm not going to be able to go work. And you just say, oh, because of this or that. Well, the medical is going to say, they're going to do all this evaluation. They said, no, I don't find anything. So the medical doctor is going to say, no. Now you can go back to work. I don't see anything that is limiting you from returning back to work. Or you have this particular problem, so you can actually do some light work. So these medical compensation doctors are going to recommend certain type of a light duty work or disability. They say, no, they're not going to be able to do anything. All depends on the condition of the patient. Not what the patient says. The patient can say, no, I cannot work. I don't want to do it. No, I don't want to do it. No, I cannot do it. So the medical providers are going to do the best to, determine exactly what's going on with the patient. It's going to be a little difficult, particularly when it comes to these subjective symptoms like pain. Because pain, how can you prove that you have or you do not have pain? So it's very difficult in certain situations. Some psychological issues, after you get into an injury, now you develop some psychological problems, you get depressed. So how you are going to determine whether the patient is actually depressed due to the condition? So again, there are certain things that are going to be a little difficult, a little challenging, I might say, when we have certain patients with certain conditions that we don't see anything physically. But it's part of the game, or it's part of, the policies, try to, to deal with these situations, but a little harsh. Estimate of the future status with regards to work or permanent loss of disability, as I mentioned before, that is the purpose that we follow up. I'm talking about the workers' compensation. They follow up with the status of the patient condition to see whether the patient can come back to work, whether full-time back again or partially, or is going to have a permanent disability. So those things needs to be decided by the medical providers. Now, just because the medical provider from the workers' compensation insurance determines that the patient it is up to, can go back to work, does not imply that the patient is going to do it. Now the attorney is going to act. The patient is going to talk to the attorney. And the attorney is someone who the patient have hired. This is not an attorney from their job. So then, it's going to be a little back and forth. No, my patient has this, and I demand that this patient receives this particular exam, this particular treatment. And they keep on that back and forth, you know, um, fight until they determine something. And usually it's compensation. How much you're going to be compensated. Now, the physician should sign original and photocopy reports. So, well, makes sense. The physician who is seeing, evaluating the patient who is in compensations case, whether it's not compensation case, the physician has to sign the medical, the medical notes or evaluations, whatever is being done. But in this case, if there are copies, they have to sign those copies. You cannot just make a photocopy. No, you make a photocopy, and the copy, the original, should not be signed yet. It should be signed after all the photocopies have been done, so you can sign then. It's not a copy that is with the signature. So most of them, they require that. So that can be altered, that can be forged. So for that reason, they want the original and the photocopies to be signed, not a copy. Remember, the copies should be signed. So it should be blank when it says physician's signature. It should be blank when you do the copies and then you actually sign. I can see the signature that is being added to the copy. Not that was a copy of the signature. That's what I'm talking about. Remember, this workers' compensation is a little challenging. It demands a lot because, remember, fraud is very possible that can be committed if things are not followed as, they've been stated according to the policies. To be generated in duplicate. One copy is sent to the compensation payer. One copy is retained with the patient's file. So we're not talking about the incident report that goes to 3 agencies: the insurance, the employer, and the patient. These are the reports. So the reports goes to not to the payer, not to the employer, it goes to the insurance, compensation insurance, and we keep it another one on the patient's file. So that's how it works. We need to be very clear about that. You see how all these documentations needs to be handled. So these cases are very, very complex. So for that reason, certain medical doctors do not get tangled, involved with these compensation cases because it has lots of requirements. You see, for your regular patient, you don't have to go through all of this. So it is too much work. And not only that, you have to wait to be paid. So they're not going to be paying you immediately as the insurance company. If you work, personal, if you use your personal insurance, that's what they have to have the insurance from the employer. So they are the one who's going to be compensated, the patient and the insurance company. That would be the money of the employer. That's basically how it is. So it will be a lot easier. But the problem is that the employer don't want to reimburse or do not want to follow the, the directions of the insurance. This patient has to get this. Are you sure? They question that. There is another test that is less expensive that can show something that we don't have to pay that much for. Because remember, when it comes to money, things get a little, challenging. And that's what happens to this. Appeals and adjudication. Now, remember that I told you that workers' compensation claims are just like any other compensation, meaning the cycle, submission, the process, the adjudication, and then whether they're going to pay or not. Well, here they follow something similar. So when a workers' compensation claim is denied, employee or eligible dependents can appeal the denial to the state workers' compensation board or commission. Now, once again, that is the reason that you hire an attorney from the beginning. They're going to follow up and they're going to be on your behalf, not the medical, not your employers or the workers' compensation. It's going to be on the employees' behalf. They're going to be fighting for your interests, not the company's interests. So basically, that's what it is. Now, the Workers' Compensation Board or Commission is going to do an evaluation, is going to read it, is going to read the case, and, to go over, they're going to have an expert, compensation medical doctors. They're going to evaluate the case, they evaluate all the procedures that have been done, all the evaluations, and they're going to determine whether they have, a leeway or merits to, to ask the employer to pay for these services or give the disability that the patient deserves or not, or the employee in this case. So that's how it works. Remember, this is very, very complex. This is not that we're going to bill directly to the insurance company saying no. This goes to a higher organization that is independent from that particular insurance. It's not the insurance itself. This is an organization that deals with all these compensation cases. And we are going to file an appeal to that organization. You're not going to ask the same insurance company workers' compensation that denied the case why you deny. Well, they're going to send you the same information. We're not going to pay for it. So you have to send it to a higher organization that controls, that supervises, that monitors all these compensation cases to see whether this case was fairly treated or it was not. So that is actually how it works. Any questions about this workers' compensation? Because that's actually how all, plays out with this thing. So very important that we understand what is the process for these compensation cases. And for you to understand what I meant when I said, that not every single doctor receives workers' compensation because it is very complex kind of, procedures to follow with this workers' compensation. Any questions? So we have few chapters, but we're gonna leave that for tomorrow. Tomorrow we'll have another chapter. I didn't want to send it to you because I thought these chapters were going to be a lot and we're not gonna finish. But actually they weren't that long. So we will cover a few more chapters. Remember, tomorrow we're gonna deal with TRICARE, which is the insurance for the military. We finish this and we move on to the TRICARE. Very similar to all these, but this is related to the military personnel that are duty and off of duty, and their relatives or dependents. So that's basic word. Well, if you don't have any questions, then we're done for tonight. Tonight's another day. Tonight's Thursday. Tonight we're gonna do something else, and then we're gonna complete these 4 or 5 slides that we have left, and then we move on to another chapter. Okay, so have a good night. Thank you for attending the class. I will be seeing you tomorrow then. Good night again.
Good night, teacher.
Good night. Take care.
Good night.
Good night now.